Barakatah Yahweh, Barakatah Yahweh Shah, Barakatah Yahweh, Barakatah Yahweh Shah, Barakatah Yahweh, Barakatah Yahweh Shah. This is your Akim, a driller Zeal, back with another quick lesson. Um, First and foremost, I want to give all praises, honor, and glory to Yahweh, by Hashem Yahweh Shah, by Hashem Rakakadash. Salute to the men I learned this truth from. And I just seen this article. It's titled COVID-19 Coronavirus. Lambda variant may be more dangerous than Delta. So, as you can see, there's just recently been the news of the Delta variant that's been introduced to the public. Just within a couple of days, now they have another variant called Lambda. So these pestilence are coming more and more known, or at a rapid speed. It seems at each approaching day. Salakia. So let me continue reading this article. As the world battles against the Delta variant of COVID-19, it's a lesser known mutation that has experts worried. Lambda, also known as variant C37, was first seen in Peru in August 2020. Since then, it has spread to 29 countries, mainly in South America. While research into the strain is still in its early days, data so far suggests a couple of key features of the variant which have experts worried. Like the Delta variant, it is highly transmissible and it may be able to dodge vaccines more readily than the original version of the virus. So they're pretty much explaining to you that these vaccines are no good against these so-called new variants, as the Delta and also as the this new Lambda that just popped up. It says it accounts for more than 80% of all COVID-19 cases in Peru, according to its National Institute of Health. Dr. Pablo Sucayem, a molecular microbiologist at Cayetano Heredia University, Lima, said indications are that Lambda is more transmissible. When we found it, it did not attract much attention, he told Al Jazeera. Al Jazeera, excuse me, Salaki. But by March, it was in 50% of the samples in Lima. By April, it was in 80% of the samples in Peru, he said. That jump from 1 to 50% is an early indicator of a more transmissible variant. In July, Lambda was added to the World Health Organization, WHO, list of variants of interest. WHO defines a variant of interest as one which has genetic changes that affect things such as transmissibility, disease severity, and immune escape, and has been known to be responsible for significant community transmission in multiple countries. So far, Lambda has reached 29 countries around the world. In an article for the conversation, Dr. Adam Tyler, Slakia, Taylor of the Menzies Health Institution of Queensland's Griffith University wrote that the exact threat Lambda poses is still unknown. At this stage, more research is required to say for certain how its mutation impact transmission, its ability to evade protection from vaccines, and the severity of diseases, he said. I mean, preliminary evidence suggests lambda has an easier time affecting our cells and is a bit better at dodging our immune system. But vaccines should still do a good job against it. It's the last point that the world is on edge about. It's that last point that the world is on edge about. Lambda has a few defining mutations to the spike protein, according to Taylor. One mutation is associated with reduced susceptibility to virus generated antibodies. This means antibodies generated from being affected with the original Wuhan strain of COVID aren't quite as effective at neutralizing lambda, he wrote in the conversation. Another mutation is similar to the Delta variant. This mutation in Delta not only increases the ability of the virus to affect cells, but also promotes immune escape, meaning the antibodies vaccines generate are less likely to recognize it. Taylor wrote, it is this mutation, according to virologist Dr. Ricardo Soto Rifo of Chile's Institution of Biomedical Science, which may be the reason for the strain's high infection rate. In research not yet peer reviewed, Soto Rifo assessed the Chinese coronavac virus, coronavac vaccine of lambda. It showed that variant could neutralize the antibodies created by the vaccine. So right there it says it showed that the variant could neutralize the antibodies created by the vaccine. So it's telling you even more that these vaccines is no good in protecting anyone from these so-called variants. It says this variant would neutralize the antibodies in the vaccines. So that would pretty much eliminate any type of protection. So reading on, these results were expected. Soto Rifo told Al Jazeera, Salakia, the virus has changed and that can make the vaccine not as efficient as it was with the original virus, but that doesn't mean the vaccine doesn't work anymore. Any other non-peer review study, Dr. Nathaniel Landu, a microbiologist at the NYU Grossman School of Medicine, showed a lab-made lambda-like virus was twice as infectious as the original COVID virus. Despite the results, he still advised vaccines were imperative. The key is that Delta and Lambda are both highly transmissible viruses, but if we get the vaccine, we're most likely going to be protected, Landau told National Geographic. And the rate of infection with these viruses is going to go down in areas where people get the vaccine, he said. We believe that at least for the mRNA vaccine, Moderna and Pfizer, that those vaccines will protect very well against Lambda in the same way that they protect against Delta virus. Even though some of the antibodies no longer works against the variants, it's still enough that they were selected that they will fight the virus and get rid of it pretty well. Peru is a country of political upheaval, which is fighting a losing battle against the coronavirus pandemic. The country has just shown in a new left-wing president, Pedro Castillo, after a nail-biting election with the slimmest of margins. His campaign centered on distributing wealth more even, distributing wealth more evenly, winning him votes from the poor rural region. Early in the pandemic, Peru was quick to bring in restrictions to help curb the spread of the virus, but case numbers continue to rise. In a nation of just over 32 million people, official records have COVID-19 deaths at 188,000. It gives the country the highest COVID death rate per head of population in the world. So, I mean, based on my opinion is they're saying that, and just on what I just read, they're saying that the antibodies from these vaccines, regardless of whatever you may take, Pfizer, Moderna, or whatever you want to call them, the antibodies from these vaccines, the variants, the variants pretty much neutralize them. If you look at the word neutralize, it means eliminate. So any antibodies that you think you're going to receive from these vaccines, as I just read, is going to eliminate. But then later on, there's try to still convince people to say that you should get it and it's going to, give you a fighting chance at, eliminating this virus. So to me, it's like you say one thing, but then you say something that totally contradicts what you just said. So me, just like the scripture says, never trust thy enemy. I don't trust these guys. It also gives me I want to quote from the holy book from Ezekiel chapter 7, verse 15. The sword is without, and the pestilence and the famine within. He that is in the field shall die with the sword, and he that is in the city, famine and pestilence shall devour him. So what's going on is we're in these, wherever you at, most people, I ain't gonna say most, but you have a lot of Jakes that are in the city. You still have some Jakes, that stay in a rural area, but the wide majority of us live in these inner cities. So as the scripture says in Ezekiel chapter 7, verse 15, and he that is in the city, famine and pestilence shall devour him. So that's pretty much the Most High is giving you a warning that not only the pestilence, um, you're going to also die from a famine. There's going to be a food shortage in these, inner cities, not only the inner cities, but the rural area. It's going to be a food shortage on a global scale. Now, let me go to this another news article. It says, this is about the USDA, Animal and Plant, Animal and Plant Health Inspection Service. This is surveillance data shows white-tailed deer exposed to SARS-CoV-2. The U.S. Department of Agriculture, Animal and Plant Health Inspection Services, APHIS, recently completed a study that analyzed um, serum samples from free-ranging white-tailed deer for antibodies to SARS-CoV-2, the virus that caused COVID-19. Results of the study indicated that certain white-tailed deer population in Illinois, Michigan, New York, and Pennsylvania were exposed to SARS-CoV-2. CoV-2. Samples were obtained opportunistically as part of wildlife damage management activities conducted by APHIS Wildlife Service across 32 counties in the 4 states. These samples were tested at APHIS National Wildlife Research Center and National Veterinarian Service laboratories. Antibodies in SARS-CoV-2 were detected in 33% of the 481 samples collected from January 2020 through 2021. None of the deer population surveyed showed signs of clinical illness associated with SARS-CoV-2. It is important to note that this surveillance was designed to determine exposure of deers to SARS-CoV-2 in their natural environment. It was not designed to determine whether the deers were replicating and shedding SARS-CoV-2. APHIS supports a One Health approach to addressing animal disease, including SARS-CoV-2, widespread human infections with SARS-CoV-2 combined with human-wildlife interaction created the potential for spillover between people and animals. Studying the susceptibility of certain mammals, such as deers, to SARS-CoV-2 helped to identify species that may serve as reservoirs or hosts for the virus, as well as understand the origins of the virus and predict its impact on wildlife and the risks of cross-species transmission. The finding that wild white-tailed deer have been exposed to SARS-CoV-2 is not unexpected, given that white-tailed deer are susceptible to the virus, are abundant in the United States, often come into close contact with people, and that more than 114 million Americans are estimated to have been affected with COVID-19, according to the U.S. Center for Disease Control and Prevention, CDC. APHIS is working closely with federal and state partners, including the Department of the Interior, the CDC, and the Association of Fish and Wildlife Agencies to determine next steps. Results from this surveillance effort are currently being prepared for publication in a peer-reviewed journal. APHIS is a multi-faceted agency with a board mission, broad mission that includes protecting and promoting U.S. agricultural health, regulating genetically engineered organisms, administrating the Animal Welfare Act, and carrying out wildlife damage management activities. USDA touched the lives of all Americans each day, so in so many, I don't think that's important. But pretty much it's telling you here that this pestilence is not only affecting, you know, us humans, it's also affecting the wildlife or the animals around us. That gives me another precept to go to. This is Jeremiah chapter 21, verse 6. And I will smite the inhabitants of this city, both man and beast, that shall die of a great pestilence. So this is the work of Yahweh Hashem Yahweh Shai. He is plaguing this planet with pestilence. He's plaguing it with the sword, pestilence, and famine. We're currently in the stage of pestilence. And the sword is on the horizon, let alone the famine is on the horizon. So this is just a warning that the true men of Yahweh Hashem Yahweh Shai is trying to reach his people to prepare for this. This is right around the corner. So I didn't intend for this lesson to be too long. First and foremost, I want to give all honor, praises, and glory to Yahweh, by Hashem Yahweh Shai, by Hashem Rakakadash. This is your brother Adril Azil. I hope this lesson was edifying to the body. And till next time, Shalom, a ball.